And I remember that it was in 2018 when I was privileged to receive this award. I guess that was the first year when these awards were initiated. And it's really nice to be back here again talking to all of you and my colleagues who have been awarded this year as Inspiring Diabetologists or Endocrinologists of the Year. So everything these days revolves around COVID. We just cannot escape it in any way. And as endocrinologists or diabetologists, COVID has impacted us a lot too. In some ways, like everybody else, but in some ways which are specific to us. From day one, we know that from the first series itself from China, we know that COVID-19 impacts people with diabetes adversely. And our own data from last year clearly showed that among people who were hospitalized for COVID, people with diabetes had poorer outcomes, especially when diabetes was accompanied by other comorbidities like hypertension, coronary artery disease, chronic kidney disease. Then we get poorer outcomes, which means that diabetes plays a very important role in determining outcomes of COVID. And it's not just diabetes, it's in general non-communicable disorders. NCDs play a major role in outcome of COVID. It's like the virus, if it's circulating around and it finds a fertile field where people with NCDs are in abundance, it takes root immediately, it proliferates, and it often knocks out the recipient. On the other hand, if the same virus is in a population where non-communicable diseases are very low, like diabetes or hypertension or heart disease, kidney disease are low, then the impact the virus will have will not be the same. It will be significantly less. So therefore, very aptly, the Lancet used the term syndemic to describe this pandemic. It's not just about the virus or an infectious disease. It's also about the marriage of infectious disease with pre-existing comorbidities, a phrase that everyone has learned now. Therefore, if we are to look at pandemics in the future, we have to make sure that we use this experience of COVID to reboot our NCD program, to make sure that our prevalence of diabetes goes down, our people with diabetes, hypertension, etc. are well managed. Because if you're well managed in this situation prior to the onset of any infection, your outcomes are very good. So I think this is a wake-up call for us to focus more on non-communicable diseases, even as a measure to prepare for any future pandemics that hopefully will never happen, but they very well might. No one has any control over these things. The other thing that pandemic has taught us as doctors, and especially for those who run hospitals or work in hospitals, that a model that encompasses just high-end surgical care is no good if the medical care provided in that facility is not up to the mark. So you cannot have standalone surgical programs doing high-end surgeries, elective surgeries, unless your internal medicine, diabetes, endocrinology, pulmonary medicine, all that is in good shape. I think this has also, it has been a wake-up call for people who run large hospitals or work in large hospitals, that the importance of physicians cannot be diminished. In fact, medicine is holistic. It looks at the patient as a whole, and therefore you cannot expect to be very, very good with some elective procedures and not good with basic medicine or intensive care, and therefore you may end up losing out. So I think these are very, very important practical messages. How did we adapt ourselves in the pandemic? What did we do to deal with all this? There was a lockdown, and there's this sort of in the second wave in particular, that there was devastation in some sense. However, even that has taught us many things. And I think it's important to realize that outpatient diabetes care can be delivered through digital medicine, digital technology, telehealth, as you call it, or telemedicine, with a fair degree of success. Now, we've, as a team, since 1st April 2020, that's over a year, done more than 8,000 formal video consults. Why I say formal? Because we don't know how many thousand we've done just advising on the phone or WhatsApp or something. But more than 8,000, 8,012 to be precise, I just checked today. And the fact is that we were able to deliver reasonable care, as I'm sure most of you were, most doctors were, through the use of technology. And that really helped. And therefore, when we compared our group of patients who were managed in the OPD versus those who were managed using technology, the outcomes are pretty similar. Just goes to say that managing chronic care, especially where we manage more of numbers on every visit, their use of digital technology is very helpful. And this will be discussed separately too, but the fact is that it made a big difference. So remote management of chronic care patients is possible. Yes. What about the impact of lockdowns? We know that lockdowns were important during the pandemic, first wave, second wave. And it is true that lockdowns probably reduced the spread of the pandemic, but it's also true that patients were actually stuck at home. So they were stuck at home, and the bulk of them, they reduced their physical activity. So overall metabolic health deteriorated. Although I must say that there were some who used this opportunity to really improve their metabolic health because they had time to look after themselves, and they were so busy in their day-to-day lives before the pandemic struck that they had no time to look after themselves. So quite clearly, lockdowns did that. To most people, it worsened their metabolic health because they were just sitting at home, couch potatoes, so to speak, and eating and whatever, and put on weight, and so the whole thing went off. So people who were pre-diabetic became diabetic. People who had diabetes, their control worsened. So people stopped testing blood glucose for some time, which is dangerous. So, and they lived in a state of escapism, I would say, for some time. But then good sense caught up, and of course, doctors overall, they contacted their patients, or patients contacted the doctors. And India is unique, one of the unique countries in the world where you can actually do home collection of pathology sampling. So this home collection of sampling was possible, and therefore patients were able to get their test done after the stringent lockdown was removed, and then get in touch with their doctors. So I think the care in the second round was clearly much more streamlined than in the first round. The challenge in the second round, however, as many of you faced as doctors and as patients, was that the numbers became so huge, so fast, that it was impossible to keep track of what was happening. And often patients were unable to find a bed or admission facility, and we had to manage very severe hyperglycemia or diabetes at home. Now that's a challenge. Normally when people have blood sugars of 400 or 500 and they're on steroids, which is one of the main therapies used in treating COVID, or at least the inflammatory response to COVID, you realize that when you use steroids, the sugars go up sky high. Now, if the sugars go up sky high, then and you can't admit the patient because you prioritize others, or there is actually no facility at the moment, at that point. So, insulin therapy, etc., management at home, glucose monitoring, continuous glucose monitoring, all this was a big challenge, both for doctors and for patients. But I think most of us were able to manage quite well. Never forget that people with diabetes have an increased risk. What can they do to prevent it? They have to maintain their blood glucose well, regardless of COVID. So they have to make sure that their blood glucose is well maintained throughout. They have to check their blood glucose. As I said, when possible, call the home collection facility draw a blood sample, get the test done. Some tests will be delayed. The eye check was delayed. The foot check was delayed. All those will be delayed. Okay. So therefore, it's important that you can deliver a lot of care, but definitely there'll be gaps. And if you need cardiac testing, then you have to come to the hospital. So it's important to remember that, again, these aspects of care should not be delayed forever. And as soon as there's an opportunity, if some test is due, the person should be called back to the hospital. Like these days, we are calling back our patients to complete their testing. The pandemic is at a real low. We don't know what's going to happen next. We also had to use a lot of insulin in this period, but insulin in this period is transient. Do not, we tell our patients, do not be scared of insulin. When you're suffering from an infection like COVID, when you're on steroids, sugars are bound to go up, and insulin is the only remedy at that point. Please don't run away from insulin. It does not mean permanent insulin. I think that's a very, very important point to remember, that patients should not be shy of insulin. So in addition to maintaining good control, trying to exercise regularly, even if it's not possible to go out, following a healthy diet, which is low in refined carbohydrate, low in saturated fat, high in fiber, high in protein, maintaining those basics, you can actually protect yourself. So people with diabetes can protect themselves from the vagaries of COVID to a large extent. And the last and perhaps the most important points here are, don't forget masking. Masking is a key weapon. The mask vaccine is the strongest vaccine against COVID or such pandemics. Please make sure you wear your N95 properly. Make sure that you are not in a closed environment with anybody. And as far as possible, what we were doing is meeting our friends outside, go for a walk with them, wear your mask, go for a walk, and you can chat on the way. Just saying, that's one way of doing it. But getting your vaccination is also very important. Even now, although vaccine hesitancy has gone down significantly, even now, at least 2-3 times a week, I get a call from somebody that my diabetes is not controlled and I'm unsure whether I should get a vaccination or not. I'm a diabetic who also has, heart disease, kidney disease. Should I get vaccinated or not? The answer is an unequivocal yes. Please do get your vaccine on time as per your eligibility, as per availability of vaccine, as per the schedule set by the ministry. Do not run away from vaccines if you have diabetes or any other underlying chronic condition. In fact, the vaccine is even more for you than it is for anybody else. With these words, I would say that the pandemic has been a real learning experience. We are still learning. It's not over. It has taught us how to take care of our patients in different ways. It has taught a lot of patients, how to deal with the technology, how to be comfortable with the doctor not actually checking their pulse or touching them. It has also given us a lot of opportunity to help people wherever we could. And I think that is in some sense the most gratifying thing about the medical profession. It has also taught us that the world is full of misinformation. And especially I was talking in reference to vaccines. And you really have to be careful where you're getting your information from. Because with social media around, anyone can post anything anywhere. And you will not know what is good, what is bad, and what is right. So trust your doctor to give you the right information. Thank you very much.
Thank you so very much, Dr. Mithal, for all those clarifications there. So doctor-patient trust is so very important. Like you very rightly mentioned, that getting oneself vaccinated is vital today in spite of all the chronic diseases. In fact, more so if one is dealing with the chronic health issues. So here's hoping for a better tomorrow. You mentioned that it's been a learning experience for all doctors. The only way forward is staying safe and if all of us do get vaccinated, that's the right direction to step ahead in. Moving forward, it's once again time for us to salute our frontline warriors. So let us once again bring to you our list of inspiring doctors as we unveil the Economic Times Inspiring Dermatologists.